Thank you. And you are welcome to this episode of Binging with GameChangers. Yeah. Thank you. Here we capture success from different perspectives. We delve into the minds of people with celebrated brands and careers who've turned their dreams into reality and their ideas into lucrative empires. I'm your host with the most, of course, Seyi. And when I get back, we'll be going on the ride. See you in a minute. Welcome back to the show, and yes, you're about to meet our game changer. Vivian Nwakah is the founder of Medsaf. Medsaf is a pharmaceutical tech platform that increases access, affordability, and quality of drugs and medication using technology and data. In simple terms, Medsaf ensures the supply and distribution of authentic drugs across Nigeria. Medsaf launched in 2017 and has so far raised $2.5 million in funding. Are you excited to meet the lady behind Medsaf? Welcome on the show, Vivian Nwakah! Yay, 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 yay! You're welcome. I mean, who builds $1 million business from distributing authentic drugs? Only people like Vivian Nwakah. Let's give it up for her. Please have your seat. You're welcome to the show. Have your seat. Thank you for coming on the show.
Thank you for having me. I appreciate it.
Yeah, I think you're doing fabulous. I mean, we found Medsaf online. I mean, myself and the research team. And when we stumbled on the brand, we were like, there's someone doing this in Nigeria, making sure that every drug being consumed is authentic. I mean, that's fabulous. You know, I won't go on and on. I'll just get right into it. So, another thing that I find really intriguing about you is the fact that you were not born in Nigeria, you were not raised in Nigeria. Mm-hmm. So Vivian you were born and raised in the US, and you've schooled and worked in France, the US, Brazil, China, as in you're well-traveled, mm-hmm. right? And you had this burning interest for emerging markets and decided to, do a part of your MBA, research and all of that in Nigeria. While you were in Nigeria, a friend of yours died from taking fake drugs, and then that was your light bulb moment. So when you had that light bulb moment, I have to solve this problem, what challenges did you think, oh, this isn't going to work? How will small me, come to Nigeria and solve this big problem? Like, what limitations came at you, and how did you get yourself past that? Because that's what a lot of people struggle with when they have those ideas. So talk to us.
Yeah, no, absolutely. I didn't land in Nigeria thinking I was just going to do whatever I wanted. I just felt called to work on this because I guess the first thing that I thought to myself was, well, who is talking about real medications? Who's talking about the problems in the supply chain, and how are they working on fixing it? So I actually spent about 2 years in research mode where I was just testing the system. So I would do interviews with hospitals, pharmacies, but also pharmaceutical companies around the world that had medications distributed in Nigeria. So it wasn't that I woke up and said, I am the person to solve this. I felt called to solve it when I saw that nobody else was paying attention to it. So I saw this as a moment of raising my hand and saying, I'm going to be part of the solution because we deserve more, and so part of even coming to Nigeria, I was born and raised in the US. I grew up in Illinois, Chicagoland area, went to school in Illinois. If you know a lot of people from the Midwest, we don't leave, but I just knew that I'm Nigerian and I'm proud of being Nigerian, and I'm surrounded by people who are proud of being Nigerian, and we want Africa as a whole to be a success story. And so there's many of us that, tried to figure out how are we going to leave the US and come to Nigeria or Ghana or, any of these other countries and be part of a success story. So when I came to Nigeria, that was in the back of my head, is that I want to be part of creating massive impact because we deserve that as people.
Yes.
And so when I got here, the first thing I did was try to fix the power situation. I didn't think that people deserve to to live without power. That problem's still not fixed, so that's another story.
Yeah.
But I felt, we deserve more. And how do you get more? You just raise your hand and you do it, and you put one foot in front of the other. So I in no way thought that, I could do anything except try.
So the approach was, I'll try.
Yes.
And I mean, you've lived in Nigeria now for 7 years, and you're still looking this beautiful. So it's not that bad after all, right? It's not that bad, right?
No, it's not that bad.
So what would you say? Okay, so what were the biggest challenges? I mean, I love that your approach to it was, I'll try. Let's see.
Yeah.
Who knows?
Yeah.
And look at it now. You've raised, about $2.5 million in funding. So that means it's possible to build stuff here.
Oh, yes.
So, but what have been the greatest challenges, though?
I would definitely say that the biggest challenges, are just trying to, get people, to do what you want them to do.
That's staffing.
Yeah.
Human resource.
So I would definitely say human resources is probably the biggest challenge in general.
Do you think it's a cultural issue, or what do you think is the problem? Because almost every game changer that sits in that chair says this, my number one problem is human resource.
Well, so, I'm going to recognize that a bit of it is privilege, right? Because I came here and I said, I'm going to dedicate the next couple of years to Nigeria. And if everything fails, it's okay. Right? So I understand that there's a bit of privilege in being able to think long term.
Yeah.
And to being able to think about building foundations and maintaining that foundation and focusing on processes and delaying gratification. I understand that there's a bit of privilege in that, but that is what is missing from the mindsets of a lot of people in Nigeria, is that long-term thinking, the long-term planning, the processes, the foundation laying. But those are also the things that have made me very successful in Nigeria. So it is that mindset that I think is different, but I don't blame people because I see,
why they are the way they are.
Why that is there.
Yeah.
But I will say that the people that work for Medsaf that are the most successful and have stayed the longest and have grown the most were able to understand that my vision was long-term, understand that my vision, that I think in the future, in future terms, and understand how big my vision was, and they were able to buy into that and trust me.
Yeah.
And then from that point, they push themselves as far as they possibly can so that they can be successful. And I'm really proud of them. Amazing. So I would say that,
So tell me, what do you love about doing business in Nigeria? We've talked about the challenges now. There must be some things that excite you when you wake up.
Well, I mean, I am a thrill seeker in a way. I mean, clearly. Yeah. I mean, before I came here, I had traveled around the world. I had, had a lot of experiences. And I would say that when I worked in the US, there were days, where I would just get in my car and I worked about an hour away. And I realized that I'm not even thinking. Like, everything is so automated. Everything is so predictable that I'm driving and I'm not even alive.
Your brain wasn't being utilized
properly. Like, I don't even feel alive, because everything is the same. Everything is stable.
Works.
Everything
Nothing
works.
to develop.
No
problems to solve.
Exactly.
Yeah.
So everything works. So when I started to travel into emerging markets, when I went to Brazil, when I went around Asia, when I started to get into these countries and I just saw how much more exciting it was, I would compare that against my life in the cornfields of Illinois, and just, I was drawn to, the excitement of being able to approach life daily with, with curiosity,
Yes.
and, with a bit of excitement. But I do feel fulfilled. I do feel like I'm pushing
Fantastic,
myself
yeah.
in really extreme ways, on a daily basis almost. And I am a person who is drawn to growth. I have a growth mindset. I feel like I will never stop learning. I'm constantly pushing myself to learn new things about the world, about people, about, business. And that's actually exciting to me. So an environment like Nigeria makes me just continuously grow.
There's always something to do and learn.
So I feel it's very exciting. I think that's a long answer to your.
But that's fine. I'm enjoying myself. We're going on a break soon, but I have to ask you this. I love that you acknowledge that you're a thrill seeker. What other opportunities and problems are you eyeing right now in Nigeria? Because I'm sure you have your eyes on other things apart from the healthcare sector.
Well, I feel like where I'm at right now is really just where I want to be from the startup perspective. After this, I don't think I will do another startup, right?
Oh, really?
I think I would more focus on writing books, like speaking about the experience, consulting, just kind of playing around a little bit with my creativity. So I won't do startups, but I am very interested in the financial sector. I do still feel that there's a lot of layers that are not being addressed right now. I do have a financial background. I was in the mortgage industry, so I see a lot of things that are necessary here in all of Africa, in Nigeria specifically, that can still be built off of the backbone of the current fintech infrastructure. So
I
that's
promise you'll be here in about 5 years' time to talk about your new startup.
No.
I will remind you of this. When we return, we'll still be speaking with Vivian. See you when I get back. And you're welcome back to the show. Don't forget to join the conversation on our social media platforms at the BWG Show. And we are still learning from Vivian of Medsaf. I love the name, Medsaf. How did that come about?
Meds Africa, Medsaf, kind of a play on that.
Nice. Please, teach us, Vivian. You, honestly, I'll be very sincere, when I read through your model, or rather, what you do, I mean, you're not creating drugs. You're simply getting original, authentic drugs from the people making them and getting them to hospitals and pharmacies that use them and need them. How did you raise funding for that? Because it sounds it sounds quite basic.
It's very basic.
Yes, and you've raised $2.5 million.
Yes.
How did you do that? To teach us. How did you make a case for it?
It's a very basic thing that is extremely problematic in this country, in emerging markets. So this is not a Nigerian issue. This is actually a global issue, right? And so if 70% or more of medications are imported into the country, and there's problems with distribution, problems with technology, use of technology among every single stakeholders, then you're going to have problems moving medications from point A to point B. You're going to have problems with quality control. You're going to have problems with demand planning and understanding how much medications need to be where at any given moment in this time. And so we are really just built a platform, but also, the understanding of the value add that we can provide to manufacturers, suppliers, hospitals and pharmacies, and eventually patients, and created a platform that ties everybody's needs together. So it is a very simple problem on its face, but it actually is a very complicated problem that really needs a spotlight. And so people who've invested in Medsaf, we have global VCs, we have, global investors as well as local investors. They understand how solving a problem like this is powerful. And if you think about, companies like Amazon or, Alibaba or any of these other large platforms,
That's
you
really
will
what
see
they do, yeah.
you will see them all starting to move towards the pharmaceutical play, because it is such an important necessity
Yeah.
for countries,
So
right?
that means the hospitals and pharmacies pay you for the service you provide.
Yeah,
So that's
yeah,
really
yeah.
how you make money.
Yeah. So, hospitals and pharmacies, they go onto our platform. They, can purchase up to 95% of everything that they need in one place. So they're just
Fantastic.
purchasing, managing. It gets to their door within 24 to 48 hours. That's our
Fantastic.
promise, right? So
Yeah.
we're now taking a process that used to take 7 days, in some cases, now down to 2 days or less. And then on the other side, we're vetting, we're doing quality control, we're vetting, the suppliers, we're aggregating, we're making sure we know where the redundancy is in the system. So if a manufacturer runs out of this medication, we then know the 20 suppliers in the system that have that specific medication. So we're taking the burden off of the macro problems that plague the country like Nigeria.
Yeah. So how easy was it convincing the hospitals and the pharmacies to pay and see value in what you're doing? Because they weren't paying for this sort of service before.
No.
So that must have been something.
So, I looked at the hospitals, specifically the hospitals, and hospitals are the hardest to service, right? Because they work with hundreds of different types of medications, and they have emergencies. They need the medications immediately. So hospitals are the hardest of pharmacy versus pharmacy. Hospitals have the biggest need. They also, have a lack of access to financing. So they also are struggling to get access to business loans and things like that. But what I've found was that if we really focus on service, being of service, and providing a good service and innovating around the needs and the feedback of our customers, that we become so important to them that they, of course, want to pay us so that they can use us again. Last year, during lockdown, we lent out about 780,000 USD of medications, and we're able to basically collect all of the money back within the terms, because customer service is important, and you can actually have a successful company by focusing on how do I really make this person feel good, like they've walked away with value.
So tell me, I want you to get a bit, more practical now, because you've been going on and on about adding value, customer service, adding value.
Yeah.
So and I like that you're tech enabled. So that means you're not client facing most times.
No.
Yes. So how do you make your clients, the hospitals and the pharmacies, feel so special? Or how do you get your team to do that? Is it are they calling every time? Give us a
no,
practical
because I feel
example.
like calling all the time is annoying too,
Yes.
isn't it? Yeah, so I'm not about that. Don't call me, but I think it's more of we actually took time to analyze what's the pain point and measure that pain point and create a service around fixing that pain point, and every single time we get feedback, we have a feedback loop. So every single order that goes out to our customers, we're extracting information back. Were you happy? What went wrong?
How
what
do they
went
ask
wrong?
them? Chat or phone
we
call
have we have a survey. So
you send that?
Yeah, we send a survey. Potentially, customer service might give them a call. We're getting that information back. So we're consistently taking their feedback, and every week we are integrating feedback into how we, talk about moving the company forward. So I feel like when you do that, even if you don't speak to the customer, but they know that you are constantly working on their problem, they're going to trust you more.
Some entrepreneurs send out feedback forms or questions, and the customers just don't respond. How do you get yours to respond?
Yeah, because we have this kind of cyclic, we have a process, right? And so we're very process oriented. The customer sends out, is requesting something, we deliver it. We want to make sure that once we've got their attention, that we're just kind of verifying that they are satisfied. I feel like in the hospital pharmacy industry, there's a little bit more of reconciliation and kind of back and forth that happens because of the nature of what we do. But it's just embedded in the DNA of Medsaf is this idea that we're here to serve the hospitals and pharmacies, that we're here to serve the people. And so because everyone knows that, and we talk about this every day, it's a big piece of the KPIs of our company, and for each individual person, it's just embedded in how we interact with the customers. So whether it's a direct phone call, or if it's an email, or if it's a text message, or if it's the way that we're gonna lay out our medications and what we choose to work on, there's a DNA that means customer service.
Fantastic.
In what we
I love
do.
that. I love that.
Yeah.
We're running off now, and it's been a delight speaking with you.
Yeah.
What keeps you up at night? We respect it. Medsaf, is it fundraising? Is it? There must be something that you're always thinking of. How do I solve this? How do I get this better?
So I just take every day as a challenge that I've got to just kind of overcome. I'm super positive, so I don't really think about challenges or problems. I really just kind of think about how to solve it like a puzzle, you know, so I'm looking for solutions. I wouldn't even say the government keeps me up at night because they've actually been kind of nice to Medsaf. So I will say, okay, you know, good job. They flew us out to San Francisco, helped us raise some money so that they did a good job here. Yeah, they did actually.
What arm of government is that?
The vice president's office did that.
Fantastic.
So I will say that they've actually been helpful.
Please, I would like to, you know, get some. Yeah, people want to learn.
Yeah,
you know. So did you write to them for assistance? How did you foster that relationship to the point where they then supported you in raising funds?
So I mean, I did a lot of competitions, you know, so I've done a lot of competitions and I've raised the profile of Medsaf, you know, just by being visible, you know, and so, you know, then you become on a radar, then you get on the radar. So I will say that the government has been helpful, but, you know, it's about scale for us. We need big contracts, we need big deals, we need, you know, to move fast, you know, so I'm constantly thinking about how can we get Medsaf in every single hospital and pharmacy across the country, and how quickly can we do that so that we can be, you know, synonymous with, you know, quality medication equals Medsaf for Nigeria, and then the rest of Africa, and then South America, and then Asia, right?
Yes, so, she's taking over
like,
the world.
Yeah, so I'm just constantly thinking about, you know, we've got to move, we've got to get scale, we've got to make stuff, foundation can move fast. So
I love that.
Those are the things that I'm constantly thinking about and then figuring out ways to execute on daily.
So definitely, I mean, now that's the answer to my question. You're constantly thinking of world domination. Yes, you want to get to the whole of Nigeria, and then Africa, and then Asia, and then the world. Yes, that's it.
And I want to show people that Nigeria's problems are valuable problems, because if you sit and you think about how to solve Nigeria's problems, to be honest, it gets easier elsewhere. So if you can create something that works here, and you can export it to other countries. I don't know if people realize the benefit of solving a problem here and then being able to take it across West Africa, where, you know, they are used to Nigerians going there and solving problems, right? So I just feel like we need to be more proud. We need to focus on how to fix the local problems here, because they're useful for the rest of the world, in my opinion.
And I agree. We agree.
Yeah.
Thank you very much, Vivian. It's been great chatting with you.
Thank you.